Good afternoon, everybody. Welcome to August office hours. Happy summer. Hope everybody's having a good summer so far. It's starting to come toward the end here, so enjoy while we have it. This is going to be recorded as usual and put on our HI Health Home Trainings page, so look out for that in the coming days as we get that posted. As always, if folks have questions along the way today or want to comment on anything, you always have the ability to unmute to do so or to use the chat function. Just want to do a quick check, make sure folks can hear me and can see my screen.
I can.
I also can.
All right, great, thank you.
Yes.
All right, let's get rolling. So we're going to go through just a quick policy procedure update today. We'll talk about the LPH form or DOH 5275, CANS assessment information, an HI safety crisis emergency plan update, IRMS updates, health home annual chart audit updates, and then our North Country Triple C training opportunities. I'm going to go over some of those for folks. Continuity of care for identified Fidelis Care members. So that's information that just came through Fidelis. Want to share with folks. And then we'll touch on the healthcare workforce bonus. That's obviously a topic that's been out there. Share a little bit of information on that. So that will be our agenda for today. Just getting into it. Policy and procedure. We have two policies that are coming. Yes.
It's Taylor. You're still on the main page, I think, for me anyway. You're just on the original slide. It's not moving through the agenda.
See if we can fix that. Oh, it's saying it's paused. Let me stop sharing and reshare. See if we can fix it that way. Can folks see the screen again with the PowerPoint?
Yep.
Great. Did you just see it advance?
Yep, now it's moving.
Perfect. Thank you. Thanks, Taylor, for pointing that out.
You're welcome.
So again, I'll go over the agenda quickly just so folks can see it again. We'll touch on policy and procedure, the LPHA form, CANS assessment update, the HI safety crisis emergency plan. We'll talk about IRMS updates, health home annual chart audits, North Country Triple C training opportunities, the continuity of care for identified Fidelis Care members, and then I'll touch briefly on healthcare workforce bonus information that I have to share with folks. Policy and procedure, just we've got a couple policies coming our way, the access to services and conflict-free case management. They're going to be annual updates, so there's not going to be any changes to those policies, but please look for them coming in the near future as we finish processing on our end. And as always, our AHI website, the policy procedure page has our most current policies updated on there. So feel free to take a peek at that at any point. Anybody have any questions or anything they want to talk about around policy and procedure today before we move on? Okay, well, if you do, you know where we're at. Reach out and we will answer your questions. So for Children's Health Home, Jessica Robertson's not in today, but she will be back tomorrow. So if there's any follow-up questions on the coming slides around children's updates, feel free to reach out to her or the Health Home email. But we wanted to make sure you got some updates today because they are time sensitive. First being the LPHA form or the DOH 5275 is effective immediately. It's only required for the SED population. And currently, also, this is only needed for the initial level of care, but it may move back to an annual form. So they're getting feedback for that to keep the form as is, and it's only required for the initial level of care. So effective immediately, it's only required for the SED population. So we just want to make sure people are aware of that. And then moving on for K codes for children's updates, no longer be required to contact capacity management to have the K codes removed if the member disenrolls from Health Home and HCBS. So if they disenroll from Health Home and HCBS, you don't have to contact capacity management any longer. But if they disenroll from Health Home and HCBS, then you will need to use the new end reason code. So there's new end reason codes that Taylor, I think they're going to be made active today. Is that correct? And that's
Yep,
smart.
I just made them active.
Okay, perfect. Thank you. So effective now, effective immediately, those new end reason codes are going to be active in Netsmart. So if a person disenrolls from Health Home and HCBS, you'll need to use the new end reason code disenroll from Health Home and HCBS, which is 56. That'll trigger DOH to end the segment for Health Home and then remove the A and K codes. If that person disenrolls from Health Home but continues to stay enrolled in HCBS, a referral to CS is required for this, and then you'll have to use a new end reason, which is disenrolled from Health Home, continue HCBS, which is reason 57. And that'll then trigger DOH to end the Health Home segment and remove the codes. And then there was one more code that we wanted to notify on here, and that's if the member disenrolls from HCBS but continues their Health Home enrollment, they'll still need to contact capacity management to have the K codes removed. So those are the changes around K codes. We have to make sure we use the correct end reason that Taylor just turned on active within production. So regardless of the actual disenrollment reason, it's got to be the correct reason. So we just want to make sure folks had that information as it is active as of today. Was there any questions around K code, around children's? All right, well, please reach out if you have them. We will do our diligence, get back to you and answer. CANS assessment. So an annual assessment effective 9/1. So CANS will be annually as of 9/1. So that means anybody who completed a CANS in April of 2022 or after, so April of 2022 or after, will automatically have their CANS moved to an annual reassessment. The plan of care and other.
Yay.
I'm sorry.
I said, yay.
That's right. I know people have been waiting to hear that finalized. So that's definitely gone through effective September. So we're ready for that. And then plan of care and other paperwork will have an updated timeline, but that's could be in policy later by DOH. So that piece hasn't been resolved yet, the plan of care and other paperwork around health home serving children. So, but we have CANS for now, so we'll take it. But stay tuned on the other pieces around plan of care updates. And then we have an additional thing that we did with Netsmart. We just finished working, the Health Home worked with Netsmart to combine the emergency plan and the safety and crisis plan. So we have it as one document. So the old template is going to be disabled within Netsmart. Taylor, is that effective today as well?
Yes, it is.
Okay, effective today, the old template, the safety emergency crisis template, they're going to be disabled within Netsmart. So we now have a new assessment, and this assessment is a combination of those two, and it's really to get more of a person-centered safety plan for children and youth that we serve. And it's, we're trying to make it so that it's more efficient as well. And so we decided to merge the two, and this is the product that we have. So you can find it under additional forms when you're in Netsmart on the left-hand side, going down to the different toggles, and it is called Safety, Crisis, and Emergency Plan. So that is for you to use as you move forward, effective today. We hope you find it to be much more user-friendly and much more person-centered for folks. Now, yes.
Quick question, will that impact anything in the data then? Because it's new forms?
Not anything I'm thinking of offhand, but we can look at that on the back end, Amber. That's a good question.
Thank you.
Yep. IRMS updates. So as of last Monday, IRMS updates came out. They're supposed to be real minimal for most users, but there's a user manual that was provided. So I put that link in here. And also there's an appendix C that identifies what those changes are. So I've got that on the next slide, just so folks can see it as a quick reference, but this manual link will get you there as well. And one of the things that Department of Health is asking is for feedback on the IRMS process. So They have asked for that feedback to come through or any questions along that. And there is a web form link here as well. And you're going to select IRMS questions only, no PHI. And that will get you to the point where you can ask questions or provide feedback or comments, etc. But the main things that came out from this update are when you're in IRMS, you might be able to view recent activity by type of on the homepage. You can create a new issue from the homepage with Report New Issue button on the issue reporting widget. Always thought that was a funny word, widget. Some issue types are now automatically accepted and closed by the Department of Health, so there's a change. You can use filter to find issues that have media coverage. You can sort closed issues by closed date. And you can also use quick filters on issue listing for unread issues and late issues. So those are the hot off the press changes that IRMS have put in place as of last Monday. So for those of you that are getting into IRMS, hopefully this will be a little more user friendly for you as you're in there. Anything around IRMS? Questions? Thoughts? Okay. We started our annual chart audit meetings with we've met with a handful of CMAs actually at this point. We appreciate all the feedback we've gotten as we've talked with each of the organizations, and we're really looking at this as a great opportunity not only to go over the chart audit piece, which is the intent to get together, but also continue that collaborative discussion with the health home and the organization, and just have an open forum to talk about different things, comment on stuff, just any questions that come along. So we're finding that we're getting good feedback on this. So please keep all your thoughts coming as we're meeting with folks, and we appreciate you partnering with us as we go through this process. It only makes us all stronger and better. So thank you. North Country Care Coordination Collaborative, the NCCCC. So it's an AHI program that's really working with improving care coordination across the North Country region. And one of the subcomponents of the main network is really looking at training component and what are the needs and trainings that care management staff may benefit from or would like to see. So there was a survey that was conducted by the NCCCC, I want to say about 5-6 months ago now, was the last round on it. And it's really looking at what types of trainings, if we could provide free trainings for the network. The feedback that came from that was really looking at topics such as burnout and de-escalation. They came to the forefront as that survey came through. And as a result, those trainings were put forth. There's been a series of those trainings. I think some of you may have noticed when I've sent out to the network over the past few months or so when those opportunities have come up, for folks to attend if they so choose. And it's had some pretty good attendance at this point, some good feedback. I just wanted to take a moment to bring this up again to the network because it is free for your care management staff, but also for anybody who may have an interest to attend. The next slide has some links on the next sessions for each of these trainings. So for de-escalation, emotionally dysregulated patients, that's September 28th. And the presenter is Charles O'Donnell. There's a registration link here. I think I had sent it out the other day to the network as well, so you can also get it through that email for those of you who received that. And then there's also an Addressing Burnout and Improving Wellbeing series. Kim Perrone puts that on. There's 4 sessions remaining, one September 21st, Wednesday, October 19th, Wednesday, November 16th, and Wednesday, December 14th. So they're on different topics around burnout and improving well-being, your resilience, work-life balance, self-care, managing priorities. A lot of those are really prevalent to our work and how we're affected by our work. And it can carry over into one's personal life as well. So, I think it's a great series that's being offered, and I encourage folks to spread the word. And if you're interested yourself, please register. The continuity care for identified Fidelis Care members. We just received from Fidelis last week. We try to get it out as soon as we can within a day of receiving it. A notification that Medicaid managed care is going to be impacted folks who are not enrolled through New York State Medicare programs. So that would be, providers that would be relevant to that. So as a result, Fidelis is saying they're going to deny payment to unenrolled pharmacies and other unenrolled practitioners and providers for their services that are enrolled, through New York State Medicaid program. And that's going to be effective September 1st. So that's a quick turnaround for those of you that have received this notification. We did send out a spreadsheet to those organizations in the network that have folks that are Fidelis participants. And we just want to make sure you got that information so that you can look into that. Medicaid enrollment status for a provider. There's a link that you can look that is provided on the slide deck. And it was also provided in the notification through the spreadsheet that Taylor Dawson sent out, and a phone number here also for any questions that come up with that. So we just wanted to stress that it is a quick turnaround for those that it's going to be impacting. Please reach out to us if there's any questions around it. And we'll do our best to work with Fidelis to get those answers for you. Any questions so far on the Fidelis piece or anything else that I mentioned in the last few slides?
Not sure if this is related, but I'm having an extremely difficult time finding dentists that Fidelis or Medicaid will accept dental that will accept Medicaid or Fidelis. Is anybody else having that problem? Is that part of this or not?
That's just the way it is. There are very, very, very few providers.
Yeah, dental is a tough one, especially.
Okay. All right, thanks.
And I wish I had some more insight at the moment on dental. It's a tough one, Teresa. But if you wanted to ask any more questions around it, we can try and see, some resources that some folks may have reached out to in the network and see if that would be helpful. I know Hamilton County is a little tough in regards to location and access to services, but we can absolutely try to hunt some down.
Sometimes the Medicaid transportation, will transport somebody. I have a client that found a dental in Schoharie County, and I have a really hard time trying to get transportation for him to get down to that dental, but it's very slim pickings. So
Yeah.
didn't know if anybody had anything that they could share. But thanks.
No, thanks for asking the question. And if something pops up, we'll get it your way for sure.
Thanks.
Yeah. Anybody else have any other questions at this point? Okay. The last piece with the Fidelis, they're asking for the health home to report back to them on status for those members that have been identified. So if you could just work with Taylor to get that in to her as far as how progress is going, so that she can report that back. We've been asked to do that on a weekly basis at the moment, just given the short timeline. So much appreciated. I know it's one more thing to do, obviously, but we just don't want people to have things lapse. So we're just trying to do our diligence to get that response back. And then the healthcare workforce bonus, I wanted to just do a couple slides on this. I wanted to be clear and preface first that, the New York Health Home Coalition is under the interpretation at this point that health home care managers would qualify, but that has not come through yet officially through the Department of Health. So that's the piece that the collaborative is trying to seek the answer on. We're trying to wait here from a health home perspective. I do believe I had noted that when I started sending the correspondence out as well a couple of weeks back as it was coming in, but I just wanted to bring that to the forefront again. that hearing officially from the Department of Health yet about health home care management qualifying. We have not heard that yet, but the Health Home Coalition through New York is saying that they're interpreting the information that they have on the healthcare workforce program for bonus, that the care management staff should qualify. So more to come on that piece. I'm very hopeful that it's going to flush through, because I think our work is absolutely relevant to other titles that have been mentioned through this healthcare workforce bonus program. And I think it would be very important, for us to be identified as a qualifying entity. There was a town hall that got sold out. Basically, the registration got filled really quickly. Last Friday, they actually ended up canceling the afternoon session due to some technical difficulties, but there was a session in the morning. And as a result, there was a recording and slides that came from that. And the link that's provided here will take you to that page, and it will give you the deck and the recording. So folks have that. Please share that with your administration, because it's be relevant to a lot of information around qualifying as a provider, and also more information on like qualifying titles and roles and how you go through the application process as a provider. Because the one thing that has been made clear is it's up to the organization, the provider, to apply to see if they're eligible for this healthcare workforce bonus program. And then the second piece to that would be any of the employees identified, are they qualifying employees for this bonus as well? So each organization would have to do that legwork to do that. The next slide I have is just different links to get more information. So the actual announcement when it came out, I believe it was on August 3rd. This first link takes you to that and some information around it. There's a healthcare workforce bonus program FAQ document that is supposed to be updated, I believe, weekly by New York State, and that document should have a lot of the answers and questions, hopefully, that are coming up each week along the way from different entities, and addressed through that document. And then the actual portal, which is going to get folks, meaning providers, organizations, registered in the system to be able to do anything as far as applying for any of the monies that would come through New York State. So the monies would go to the organization. It wouldn't go through the health home. It wouldn't go through AHI. It would come through the individual organization, that the care management agency itself, is my understanding. So I just wanted to make sure folks knew that as well. And there's some contact information here, 1-800 number, and then an email for any questions that be relevant to the program, to the New York State Health Department. And I hope I answered some of the questions people might have. I unfortunately don't have a lot of significant detail around it, but I just wanted to get the general information out to everybody. And once we hear an official through either the Health Home Coalition or the Department of Health about health home care management role qualifying, we'll be sure to let folks know. Anything around this piece? Questions? I'm hopeful it's going to come through. I'm really hoping it happens. It would be a nice way to supplement some folks' income. You got holidays coming. I just think it would be a beautiful thing. So I'm very hopeful that that it all flushes through for folks. Anybody have any questions in general? Anything they wanted to talk about for us this afternoon before we wind up?
Hey Travis, it's Jessica Casey.
Hi, Jess.
Hi, I just had a quick question regarding any updates on the reports in Netsmart changing over, and any tentative plans for when that's going to happen, and when we might need to do our reports.
Yeah, that's a great question, Jessica. That was a hurry up and wait, and we're still waiting. We meet with Netsmart biweekly, and that has not come to a resolve on their end at this point. I know they were doing a lot of back-end engineering work on that. We can put it on the docket. Taylor, we could make sure that's on our docket for our next meeting with them. We can talk about that because that was supposed to happen. Now I'm remembering that like by May, I think was the last time it was supposed to kick in. But we have not gotten any further update. And there, we do know for a fact, though, that when that time comes, they were going to not turn off the current process for a couple months until folks had a chance to get in there and you know, get into the new way of doing it. So it wouldn't be an immediate shut off when that time comes. But we'll get back to you on a date on it, because that, and there was a couple other things. One of them was a comprehensive assessment. There was supposed to be a change on that, and that was another hurry up and wait scenario that we're waiting still because there's some back end engineering stuff on Netsmart's end, because we were running into a lot of errors when we were testing it when they have it in our UAT environment, and it was a lot of coding stuff that they had to go back and to address. So that's the other one that's not finalized yet as a result that we're waiting for as well.
Thanks. I remember feeling relieved that those reports were going to be available when they switched over, but I just wasn't sure if there's any updates on that. So thank you.
Oh, absolutely. Taylor, did I miss anything? I don't think.
Nope,
think
you
it's
got
all-
it covered.
Yeah, it's pending. Yeah, but we'll be sure to get back to you all on that. Anything else? Anybody have any other questions, thoughts, comments, concerns? No? Just realized I was on video the whole time today. So whoever gets to watch the recording will get to see my my shiny face as you're hearing me talk. So here's our provider network. We have St. Joseph Rehab Centers and People USA that are still going through their MIS application. They have them submitted, as I've mentioned, but it's been pending. You know, that EMED application process takes a little bit, but we're hoping to hear something soon on those two. And we also started preliminary work with the Shelters for Saratoga. So they're starting to fill out an application as well. So once they've officially let us know they've gotten that in, I'll add them to this list as well. So those are 3 in the hopper, if you will. And you know, we're excited about that as our network continues to grow, and we'll keep you all posted on that.
I feel like we got lost. You dropped me off your list. Did you fire us and we didn't know?
Where?
Where am I?
You're there, right under Way House.
Oh, I see me. Okay. I was like, geez, what happened here? Sorry.
We'll never drop
We'd
you
never
off,
lose
Lori.
you, Lori.
We're not gonna.
Even
You're
if you
stuck.
wanted to.
Stuck with us forever, Lori. That's a long time. Anybody have anything else? Anything? No? All right. Well, thank you as always for all you do, and appreciate you taking the time today, knowing that it's summer winding down. So thank you all. Hope you have a good one.
Take care, everybody.
Thank you.
Bye-bye.
Bye.